Speaker, I have a motion to instruct conferees at the desk.
Clerk will report the motion.
Ms. Esty of Connecticut moves that the managers on the part of the House at the conference on the disagreeing votes of the two houses on the House amendments to the bill Senate 524 and act to authorize the Attorney General to award grants to address the national epidemics of prescription opioid abuse and heroin use be instructed to recede to Title III of the bill relating to treatment and recovery programs.
Pursuant to Clause 7 of Rule 22, the gentlewoman from Connecticut, Ms. Esty, and the gentlewoman from Indiana, Mrs. Brooks, will each control 30 minutes. The chair recognizes the gentlewoman from Connecticut.
Thank you, Mr. Speaker. I yield myself such time as I may consume.
The gentlewoman will suspend for 1 moment.
Thank you.
The House to be in order. The House to be in order. The gentlewoman is recognized.
Thank you, Mr. Speaker. I rise today to offer a motion which would instruct the appointed conference committee to prioritize prevention, treatment, and recovery programs for folks suffering from prescription opioid or heroin addiction. But all of the good legislation that we worked on so hard this past week in the House is close to futile without appropriate federal funding. It's all too easy for us to say we support helping folks who suffer from addiction to get the treatment and resources they so desperately need, or to support community programs that spread awareness about the dangers of prescription drug use, or to instruct and support medical professionals about the risks of opioid addiction. But it's time for us to put our money where our mouth is. This year, the President requested that we appropriate $1.1 billion to help the American people to prevent and treat addiction. It's time for us to act on that request. It is not enough to adopt important policies that we have this week on prevention, on treatment. We need funding. We must provide adequate federal funding to prevent addiction from occurring in the first place by expanding our prescription drug overdose prevention strategies. We must provide adequate federal funding to help save the lives of those who have intentionally or accidentally overdosed by improving access to the overdose reversal drug naloxone and support targeted enforcement. And we must help our local law enforcement by supporting targeted enforcement activities. Families across my district in Connecticut and across this great nation are reaching out to our offices, asking for support and help, asking us to come together and to address this public health crisis. Recently, I was contacted by a family from my hometown about a young woman who was a classmate of one of my 3 children. They've lost track of this young woman. She has fallen into the grips of addiction and has disappeared for years from her family. They are trying to seek her out, find her, and get her treatment. And we were successful in finding her in a court. We were successful in getting her a bed. Sadly, she turned down treatment at this time. That is the story of what addiction does to families. We are hopeful that she will heed the voices of her family, that she will come back in and get treatment. But that is also why prevention matters, because it is so hard to treat addiction. We need to do everything we can to prevent folks from getting addicted in the first place. And that is why some of the provisions I included in this bill are so important. To make sure the public understands the risk of prescription drug addiction, to make sure that our medical professionals get continuing medical education to understand their responsibility to look out for their patients, to seek out alternative pain management strategies, and to understand those risks. But the sad truth is we don't have enough treatment beds. The sad truth is we don't have dissemination of best practices. The sad truth is we don't have the funding right now to address this crisis in the way that the American people want and need us to do. So let's work together. Let's work together to prevent our children, our families, our friends from being so poisoned by this addiction on our streets. But we can't do it without funding. It is just unfair not just unwise, it's unfair to claim credit for solving a problem and addressing it without the funds that need to go there. So let's work together to provide funding. Let's, in our conference with the Senate, seek to put the resources there to back the wonderful policies that we adopted this week in this House. So again, I urge my colleagues to support these instructions to instruct our conferees. I reserve the balance of my time and